Good afternoon. I'm Mark Ramey, Chairman of the Marion County Board of Supervisors. I'm here with Kim Dorn, Director of Marion County Public Health, again to provide you with another update on COVID-19 and what is going on in Marion County. So Kim, we've got some updated numbers for everybody. Some are positive, some are not as positive, or at least not what we'd like to see, but maybe run through the updated numbers that we have.
All right. So as of this morning, we have 39 active cases. So our number of cases is way down. Unfortunately, we've had a total of 9 deaths. So there have been a couple more deaths this week.
Okay.
And then we have 764 who are recovered. So currently, about 1/1000 of Marion County population is infected with COVID.
Okay.
Currently.
Excellent. So, I mean, so we're seeing the virus run its course.
Right.
People are practicing social distancing, washing hands, all the things that we've talked about, wearing masks when appropriate, and we're seeing those numbers drop.
We are.
Still, one death is one death too many. We do send our condolences to all those families who have suffered through that as a result of this outbreak. But overall, the numbers are trending positively.
That's correct. We're heading the right direction. In August, it was common for us to have 30 and 40 new cases every day.
Right.
And we had roughly 140, 150 active cases at one time. So this week, we've been having single digits for new cases, so under 10 every day this week, and a total of 39 active cases. So that's a vast improvement.
Yeah, excellent. So we'll talk here in a little bit as we get to fall and winter and flu season and some of the things we might want to just warn people about ahead of time. Again, the behaviors that we've talked about are still valid for that as much as they are valid for COVID.
Correct.
So we need to have that conversation as well. But let's talk about long-term care, assisted living. I know you and your staff have done a tremendous job with contact tracing and working with those facilities, and the folks in those facilities have worked extremely hard to make them as safe as possible.
They have. So we continue to have one facility who's in outbreak status, and that's on the state website, so you can see that if they go look. The staff are still working hard to work through it, and it's going to take an incubation period or two for that to come off. I mean, even if everything goes just right, it's still going to take a little bit of time for that to come off of that status.
Okay, so we need to see if there are more cases in those facilities yet, and probably take a few weeks to get that, to let that play through and see what happens.
Right, because the incubation period is 14 days, so anything can happen in those 14 days.
Okay, very good.
Even if everybody does everything right, it's still possible.
Yeah, okay. Serology testing, we're not doing that. We're not able to do that, and the reason for that is?
Well, we just don't have the staffing to do that right now. The serology testing is not as critical to us as far as it doesn't do diagnostic. It's not diagnostic, and to find new infections. So we're going to stick with PCR testing because that's what we need the most. And then we also we're still doing case tracking, and now we're in preparation for vaccine to arrive. So we're starting those preparations, and that takes time. Sure.
So, but again, we'll talk about vaccines too as well. So I think that's an important point. Everybody focuses on positivity rates. We know that number has an impact on the schools, and that number is trending down as well. So where are we at with that?
Yeah, that number is at 7.2% as of this morning, and if people will remember, right after they started keeping track of that number, we were up over 15. We were like close to, I think we were at 17 something. Yeah. And so it's heading the right direction, and things are good as far as that's concerned. We don't have any schools. That's one of the numbers that they pay attention to. The other number is their absentee rate related to COVID, and we don't have any schools that are over the 10% as far as I'm aware. So I think we're in good shape there.
Okay, excellent. So let's talk a little bit about where we're at right now before we, again, talk about the behaviors. So we're coming up on fall.
Right.
Everybody thinks cold and flu season.
Mhm.
We know that that's coming.
Yeah.
So what do people need to think about related to COVID, colds, flus? If we were to talk about the behaviors that people need to think about, what are those, Kim?
It's the same thing we've been talking about all along.
Okay.
So the social distancing, 6 feet from people who you're not normally in contact with. And if you can't socially distance, wear a mask. Wash your hands with soap and water, 20 seconds, use hand sanitizer. Sneeze or cough into a tissue or inside of your elbow. And especially stay home when you're sick. And because it's going to be hard to know whether are they sick from flu, are they sick from a cold, are they sick from COVID?
Yeah.
And it's important to remember that the common cold is one of the coronaviruses.
It's a derivative of COVID-19.
It's right.
Of the same family.
It's in the same family of viruses. So
Yeah.
there's seven siblings in that family of viruses, and so it could be any one of them, but we don't want anybody out spreading any of them.
Right. So cold, flu, COVID-19, it's a lot for folks.
Mhm.
It puts an extra burden on people to be thinking in that way. We're
Yeah.
used to dealing with cold and flu season. We go to the doctor, some people get their flu shots, but this is different. We've got a different circumstance this year and probably going into next year. Vaccines. So have we received, when we reported on last time, we're getting a heads up to be ready.
Mhm.
Think about distribution. Do we have any updates on that?
I don't have any updates on the COVID-19 vaccine. We are starting to do flu vaccine clinics.
Okay.
So hopefully a lot of people will get their flu vaccine so that we can kind of tamp that down a little bit, and hopefully that'll be a good match this year.
Okay.
And so we're encouraging people to get their flu vaccine, and then and right now we're just in preparation for receiving the other vaccine.
Okay, so, all right, still in preparation.
Yep.
All right, very good. And your folks are continuing to do contact tracing on all cases.
That's correct.
I know your department's done a phenomenal job, and so have the folks that have been working with them.
Mhm.
This is a key component. It's what other counties in other states stopped doing, which I think led to some of the
Some of the
issues that they've
problems.
had. Yeah, so,
Right. Yeah, they're doing a great job. My staff is working daily with school staff, at all the school districts. So it's going very well, and everybody's working together really, really well. We really appreciate those partners. We're also continue to work with both hospitals and clinics, and so everybody's communicating well, and we're all on the same page right now, so that's good.
That's good.
Yeah.
That's good. Well, again, social distancing,
Mhm.
wash your hands,
Right.
stay at home if you're sick,
Mhm.
wear a mask when appropriate,
Right.
sneeze into your elbow.
Yep.
And whether it's cold, flu, COVID now, we have to think about all three of those things. Okay. Well, thank you again for joining us for this update. Again, our thanks to all the residents of Marion County, our businesses, all of our nonprofits, and the long-term care facilities, hospitals, our medical professionals. Just done an excellent job working with Kim's staff to help slow the spread and help, again, get us down the road on this crisis. The numbers are improving. Let's hope they continue that way. If we continue to practice these behaviors, we'll see continued improvement from where we are right now. So, Kim, thank you for the update.
You're welcome.
All
Thank
right.
you.
Have a great afternoon.